this is Dr. Green with Momenta Chiropractic, and today we're going to talk about IT band syndrome. So, what is the IT band? It's referred to as the IT band, which is short for iliotibial band. It's a thick, fibrous portion of fascia or connective tissue that runs from the outside upper portion of the hip, kind of near the glute, all the way down the outside of the leg, and then connects just below the knee on the outside as well. IT band syndrome is a pain complaint that is most often found in runners, but can also come up in patients who are weightlifters or play sports that require a lot of squatting or lunging. And essentially, it's a pain complaint that pops up on the outer portion of the knee, just below the knee joint, and kind of becomes like a sharp, almost like pinching or burning pain down at that region. So in the past, we thought that IT band syndrome was more due to friction of that insertion of the IT band just below the knee because of that constant kind of flexion and extension of the knee. What we found through recent research is it isn't necessarily friction as much as it is compression of the certain area. So just underneath that IT band attachment, there's a layer of fat that's like almost like a protective tissue just underneath that attachment point. And what happens is when the IT band becomes tensioned, when the knee kind of comes inward a bit, it puts tension through, and then as the knee flexes and extends, it adds more compression to that area. The fat that's underneath there is highly innervated, meaning it has a lot of nerve supply, and when it becomes compressed, it becomes sensitive and then painful. So one of the biggest things, and we'll touch on this in a later video, that we see that causes IT band syndrome is allowing that knee to crash in while we run and then coming back out. So longer distances that runners have, it ends up kind of becoming more and more apparent as muscles in the glute start to fatigue. The knee starts to kind of crash in more and more, increases the amount of compression, and then increases the pain. It can get to a point where it makes it difficult to run, and that's typically when patients come to see us. So we're going to be diving into how we go about diagnosing IT band syndrome, some of the treatment that we use for these patients, and then also some of the rehab exercises that we prescribe to see if we can fix some of those underlying movement impairments to be able to get them back to running and not feeling that pain. So be sure to check those out.